Right. So, ngayong umaga, kasama po natin ang manager ng health services ng Philippine Red Cross, si Dr. Anne-Claire Reyta. Narito rin po si Father Luke Moortgat, isang CICM missionary at dating Executive Secretary ng CBCP Episcopal Commission on Health. Siguro kay Dr. Reyta tayo magsimula. Doc, sa inyong pag-ikot sa Pilipinas, gaano ba kalusog ang Pilipino, lalo na sa disaster areas? How would you describe the well-being of Filipinos, not only in urban areas but in the rural areas as well?
Oh, good morning. Nagulat ako sa unang tanong. Kasi how would you describe a person, a Filipino, how healthy he is, especially sa disaster, no? Sa context kasi ng Philippine Red Cross, we do not focus on the physical well-being of the person, but the wholeness of the idea of being healthy. Let's say since the question is on disaster area, so siguro I would say talaga is less than 5% out of 10 are healthy kasi we consider that in a disaster area. Especially in the rural areas, sad to say no, pero kulang talaga tayo sa doktor, yun ang una. Pangalawa, if ever we have a doctor in the area, yung access, kasi very, very little access, especially dun sa far-flung, like the areas I visited just last week in Samar. How could a pregnant woman reach the health center if you need to travel 6 hours from, let's say, Dolores, Samar, going to Borongan, where enough or the facility equipment and the doctors are there. There might be small health centers that you can find in each municipality, but if you enter it, you might be imagining that this is not a health facility but a bodega or what. So this is where Red Cross come in. This is the only thing we could do because the Red Cross is still an augmentation to the Department of Health. We do reconstruction, we do equipping of the facilities, but we cannot provide the health service, the staffing for doctors. In the context naman ng disaster, we could assist people in that area in a way that we are servicing them. We have the social services, we do referrals of whatever health problems or health concern that we can find. And Red Cross can only do so much. Yon, siguro later.
Doc, I would like to believe that you've been with the Red Cross for several years, right? Without necessarily telling us kung ilang dekada na. Pero, have you noticed any improvement in the condition of people in disaster areas over the years?
Well, it's okay to tell you I've been with the Red Cross for 7 years. In those 7 years, I've been working with the blood bank. Now it is my 3rd month working as a manager of the health services. So improvement in a sense like they were able to continue, or the activity that has been introduced by Red Cross. There are some. Let's say, for example, the project we had with the Japanese Red Cross in Quirino Province. It started way back 2006, if I'm not mistaken, 2007. Wala silang water source, so that caused them several diarrhea cases. Walang proper equipment yung mga health centers, and we did give them some. The schools do not have wash area toilets, so it's very difficult for children then to promote hygiene. So what PRC did together with the Japanese Red Cross is we introduced the CHAST, the FAST. So these are programs on hygiene and promotion. And last month I visited Quirino Province. it was really a good feeling that whatever we started way back is still existing. And the volunteers are now doing the sustainability activities, like yung nilagay namin doon na tank for the school, na gumagawa sila ng activities like they share responsibility of cleaning the tank, they share responsibility of taking care of the water source, yung mga alaga nilang mga hayop, hindi nila pinapalapit doon. I mean, it is not for Red Cross to continue these services to them. We just need to introduce it to them. We just need to let them know how to do it. And then the community's share for the project is for them to learn how to continue the project and then set their own sustainability. But there are some that still cannot do the sustainability activities. Basically, as I noticed lang they lack support from the LGUs kasi, or the barangay captains, kasi if they don't have that support, it would be very difficult for the community members to do the sustainability of the project.
Mukhang hinagpis tayo ron. Father Luke, you were with the Episcopal Commission on Health for some years. What have you noticed? If we're to talk of the well-being and health of Filipinos, have you noticed any improvement over the years?
Yes, absolutely. But first, thank you, though, for inviting me. And in line of what Mom says, yes, I have seen much improvement, not only during the 17 years that I was Secretary of the Commission on Healthcare. Now I'm only Program Director. But from the time I arrived here in the country in '76 till now, there is a great progress, absolutely. And we see it on different areas. Now, we are more aware of the problems, but being more aware of the problem does not mean that the problem is worse. When you close your eyes, you're not aware the problem is there. So I make a big distinction between awareness and the severity of the problem. For instance, TB, we now know better how many there are. Still, there is a progress. There is more respect for the people with disabilities. Oh, we still have a long way to go, but there is more. The situation for the mentally ill has improved. I remember, it's not difficult to remember, that I've been arguing that there would be more beds in mental hospitals for people sleeping on the street. I went to the president, Gloria at the time. The department didn't move. I went again. She wrote again, and it changed. Now we are working on a bill for the mentally ill in Congress, things that would not have happened 20, 30 years ago. So there is a real progress. I am very happy that I can be part of this, yes.
Yes, but Father, while the problems remain, the respect for the disabled has improved. In fact, pieces of legislation have been enacted into law. Now, what about the special care for the mentally challenged?
I'm sorry, mentally ill.
Mentally ill.
Mentally challenged is more people with a low IQ. We talk about mentally ill, which is a medical problem. Well, part of the problem is the general attitude of the population. In a more or less democratic country, you will have more or less policies of the government that reflect a little bit the general opinion of the people. If the people don't care, chances are that the legislators and the department will care less too. Yes, but it's very sad, but still there is an improvement. A couple months ago, we had a big meeting of the Psychiatric Association of the Philippines, and the discussions there really show that there is much more respect and concern for these people. Still, we have to improve. But that also shows, I compare it with people who sleep on the streets, regular people around here. If you notice, they sleep on cardboard or at least on the plastic for hygienic reasons. That's why I felt so bad years ago when there were so many people in the mental hospital sleeping on the floor without cardboard, without even the plastic. Things like this are improving.
Very well. Okay. Doctor, it's been said that the manner of eating among Filipinos changed with the introduction of fast food and noodles, and very recently, energy drinks. Now, have you made any study or have you come across illnesses related to the kind of food that people eat?
Guilty ako dyan. Kasi favorite ko ang mga fast food. Yeah, it is now the trend in the modern medicine to look into what we eat. Because it has been, hindi mo masyadong malayo yung time na intern ako at estudyante ako. Pero at the time na nag-start pa lang ako ng medicine, usually I get patients as old as 70s or late 60s who had MI, heart attacks, diabetes. Before I end my medicine years, I saw an actual 10-year-old boy who had diabetes. And now, I might as well tell you that there are specialists, pediatricians who specializes on taking care of what our children eats. This we call the endocrine pediatricians. So I subjected 3 of my kids, all my kids, to that pediatrician because we have a very strong family history of both diabetes and MI, heart attack. So we really have to look into consideration what they take in the body kasi it is an accumulation of not so good kind of cholesterol in the body that may eventually show as early stages of diabetes for the kids. So in line with where I work with the Red Cross, I am now my department now is working with the German Red Cross Danish Red Cross to promote healthy lifestyle. So we started this project, the inception of the project was last December. So this is just a pilot program for the Red Cross. We're starting it with Manila chapter and the Quezon City chapter. So if we just started with a baseline cap, which is, we are in partnership with the UP Manila College of Public Health. They are the ones who do the study on this, not me. I'm not from the academe. But the baseline studies that the UP Manila got will be used as a basis or a baseline for the project that we will start on. So there are several chosen schools for Quezon City and Manila. And if this project will really go as we planned, there will be several orders or this law that will be given by the school, and we are expecting the sanggunian of the barangay and of the city of Manila and Quezon City to do the same. So they have to give out, you call it law, within the city to provide students the right kind of food in and out of the school.
Very well. The reason I ask is we are aware of tragic accidents, especially at night, involving taxi drivers. The reason I ask is there may be some correlation with the kind of food they take and the energy drinks that encourage them to take in almost unprecedented amounts, which may in a way have affected their systems, which caused tragic accidents. Now, Red Cross usually responds to emergencies. Have you noticed anything like that? Kahit sa umaga, makinig ka ng radyo, ina-advertise yung mga energy drinks. Sabayan mo lang ng 2 pandesal, okay ng almusal ito. Pero it doesn't show any impact on one's kidneys. And poor taxi driver, when he gets sick, he still has to pay for the boundary. Because that is what is the arrangement between big taxi companies. Doctor.
Well, it's quite difficult to put into words what all of us know, no? I would just say maybe it's because of the behavioral change that we are having now. The lifestyle that we are having now, it is not the same as the time when Father Luke started in this field, no? We really have to work so hard to feed, you know, to get our family going. So we have to find ways where we can eat fast. We don't have to cook food. And we need to stay awake just to, you know, to have longer time of work. So that's why we rely on these energy drinks, power drinks. But yeah, common people would not know what makes these power drinks make it a power drink. There are contents which are considered as not good for the body, especially for the mind, because sometimes it induces release of certain hormones that keeps us going. So this inclusion in the ingredients really defies the normal process or circulation in our body. So if our hormone secretions are disturbed, so definitely there are other forms of, even the attitude of a person may be altered if the hormones are not balanced.
Naku, nabanggit na yung hormone. Baka kung saan tayo makarating dito. Yung hormone daw dun sa manok, kaya dumadami ang happy and gay. I don't know, pero kung may relasyon yun. Father, look, without incriminating yourself, I'd like to ask you, how young are you, Father?
Oh, I'm only 75.
75?
Yes.
Really?
Only 3/4 of a century, so still have a few more days to go, you know.
So what's the secret, if you have any?
Well, I don't know. I'm just making plans for 25 years from now. 25 years from now, I will change profession. I will become a money changer.
And why?
I'm already practicing. I have coins because the deaf and the blind, they get easily cheated in the jeepneys. The deaf don't know what the driver says, san kagaling, he thinks san ka pumupunta, wo 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 wo, and the blind don't see the coin, so they ask me for exact change. So 25 years from now, I will be a money changer.
Really? Well, maganda ito. Pero what about the kind of food that you have been eating all the way years back?
I'm not an I'm not an expert in that. I barely know what is the food that I eat. I live in the convent. You eat what comes on the table, and I often don't even know the name of the food. So I'm not the person who is choosy for the food. They give me that, I eat it gladly. So I'm not too much about this, but it is a real problem. I would agree with Doctora. And you see, the lifestyle has changed. When I was a bit younger, still younger, we didn't get allowances. We came out of the war, and we didn't get allowances to buy anything. Now the kids, they have allowances. Not just for their jeepney, but they buy their lunch and have much food money left to buy candies and so. In grade school and high school, I never got 1 peso allowance. Exact money for your transportation and things like that. And at lunchtime, we went home to eat. So we eat always at home.
Yeah?
Different. Life is different, yeah.
Really? We'd like to acknowledge, narito na po si Dr. Ces Acuin. Siya po ay mula sa pamantasan ng Pilipinas at ang kanyang pinagkakaabalahan ay yung universal health care. Ito po yung paksang napakalapit sa kanyang puso. Matanong ko si Dr. Ces. Dr. Ces, welcome to the program. How universal is our universal health care? Yeah.
Okay.
Yes, please.
Well, Morning, everybody. I'm sorry I'm a little late, but
It's the traffic.
let me update you, Melo. I'm now with the Food and Nutrition Research Institute.
Very good. Very
Yes,
good.
and I just heard you talking about food. I'm still with the Universal Healthcare Study Group as a consultant, but my more full-time engagement is now with the FNRI, with the Department of Science and Technology. And that's why when the invitation came to talk about the nutrition, well, the health situation of the country, I grabbed the opportunity because, as you know, FNRI is in charge of collecting the National Nutrition and Health Surveys. So we conduct that every 5 years. The most recent one was in 2013, and we have been steadily processing the data since the data was collected in 2013. Some of you may have been around when we disseminated the first round of results from there, and then, but we continue to update the processing. So I will get to universal healthcare
Later.
in a while. Yes,
Okay.
I'd like to share some of the highlights. I have some of my slides, but I will, in the interest of time,
Yeah.
let me just go ahead and share some of the results. And since you were talking about food,
Yes.
let me start with the nutritional status. Okay.
Very well.
Is that
Nutritional
okay?
status.
All right. So that's also one of the more frequently collected data or our indicators that we have of our health and nutrition status. So nutritional status, we measure the height and weight of people as well as their waist circumferences and their waist-hip ratios. So for our, those are what we call anthropometric indicators. And then we also collect blood samples. And so we measure things like anemia prevalence and also things like vitamin A deficiency and from other body fluids like urine, we measure whether people have iodine deficiency. So those are just examples of the things that we do to measure the nutritional status of people as part of the survey. So going back to the anthropometry, one of the things that concerned us with the last survey in 2013 was that it looks like we are not, well, we are pessimistic that we will not meet the Millennium Development Goal for reducing underweight prevalence in children who are 5 years old and younger. And that is because our underweight prevalence was supposed to go down or was targeted to go down by 50% from 1990 levels. And in 1990, I think it was somewhere around 27%. And so the end line for the Millennium Development Goals is this year, that's 2015. And when we conducted the survey in 2013, the prevalence was still at 20%. So although it has gone down from 27, I think it's unlikely that in 2 years' time we are going to reach 13.5, which is the level of 50% below 27%. So we're really worried that we're not going to meet that. We have another survey this year, pero you know it's a little disheartening that in 2013 we had not met that. Also, our levels of stunting. Stunting is yung bansot, no? So, the height is, underweight is easy to understand. Kulang ka sa timbang. But stunting is a little more complicated in the sense that kulang ka sa height, but the kakulangan sa height can come from a number of things, not just your diet. For example, if a child gets sick very often, then the child can also wind up stunted even if he is eating relatively well. So our stunting rates are even much higher than our underweight prevalence rates. So they are about 30%. Yeah, although bumaba na yon from the last survey. The last survey was in 2011. At that time, it was 33. This is for children 5 years and younger, no? So at that time, it was 33. So now it's 30. So at least it's going down in the right direction. I mean, it's going in the right direction.
Anong taon po yung
still high.
33%? Anong taon yung
2011, yung 33%. And then in 2013, naging 30 na siya. So mamaya, if we have time, I'll show some of the slides.
I hope we can generate a projector later.
Oo. So yun yung for children. But unfortunately, in the Philippines, we are experiencing what we now call a double burden of malnutrition. So in children, the undernutrition rates are still high, whereas in adults, it is the overnutrition rates that are going up. So, halimbawa, among Filipino adults, the prevalence of overweight and obesity is now at 31%. Ibig sabihin nun, 1 out of 3 Filipinos, adult Filipinos, is now either overweight or obese.
Is it because we have 100,000 plus policemen?
This is on average. No? So I don't think this is due to just the police. I think this is due to everybody not eating the right things and not physically active.
Okay. Doon po sa bagay na yun, Doctor, yung bang pagbabago ng pagkain, pagpasok ng fast foods, nung kasing kabataan ko, decades ago, taho lang at puto at kalamay ang ibinibenta. Pero ngayon, you have fast foods in almost every corner. How do you look at it?
Well, I'm going to base it on data. Again, the proportion of energy, what we call energy, or calories that we consume coming from fats and sugars has increased. So the amount of food we're eating hasn't actually changed very much in terms of grams. So yung timbang ng pagkain na kinakain natin, halos pareho. Pero yung proportion na nanggagaling sa fatty foods and from foods that are high in sugars ay tumaas. And so overall, mas mataas yung calories, even if the volume of food has not changed very much. Now, it is likely that pwedeng factor nga yung fast foods kasi alongside that trend of increasing fat and sugars in our foods, we're also seeing that, especially in urban areas, mga more than half of the households now eat their foods outside the home. So, hindi na tayo kumakain, kumakain pa rin tayo sa bahay, but the frequency is decreasing, especially among urban households. So, it is very possible that it is this practice of eating outside the home where the fast foods comes in. Kasi syempre, yung fast foods para mabili ay kailangan masarap. At ang mga paraan para pasarapin ang pagkain ay dagdagan ang fats at dagdagan ang sugar. O kaya dagdagan ang alat. And that's another issue. Tutuloy-tuloyin ko na. I hope you don't mind. Salt, as you know, high salt intake is a risk factor for hypertension. And we are also seeing, although in terms of hypertension, medyo bumaba ng konti. No? From 2008 to 2013, bumaba ng konti actually. I think it was from 31% to 25%, if I'm not mistaken. Or basta, because I don't have my my slides in front of me. Pero bumaba siya ng konti. And we think it may be because of the efforts of the Department of Health to increase the medications available in health centers. So I don't know if you notice that we now have what they call compacts, or these are treatment packs for hypertension, for diabetes, for those with high cholesterol. Kasi itong mga sakit na to, hindi yan katulad ng halimbawa ay pneumonia. Pneumonia is an infectious disease of the lungs. You give a course of antibiotics for, let's say, a week, and usually you're cured. No? But hypertension and diabetes are chronic diseases. So you cannot take the medicine in just 1 week. Once you are diagnosed with hypertension or diabetes, you need to take your medicines for life. You may be changing the medicines, from time to
Or
time.
until you can no longer afford.
Well, that's where the government needs to come in. Kaya nga may compacts ang DOH. Kasi they recognize that the medicines are not always affordable. So yung mga gamot na yan, kaya tinatawag na compact kasi complete treatment packs. They do not give just 1 or 2 tablets. They give you, supposedly, this is on paper, they're supposed to give you a whole month's supply, 30 days worth. Because nga, they know that taking it for a week is not going to work.
Okay. Very well. Bubuksan natin ang floor for our colleagues in the media. Doc, would you care to react sa experience ninyo sa Red Cross? Mabavalidate ba yung sinabi ni Dr. Ces?
Regarding the medicines?
Medicines and the illnesses. Yung mas maraming overweight and obese ngayon, mas maraming bansot sa mga bata, 5 years old pababa.
Yeah, actually what I have for doctor is a question. Sorry. It is good that in the recent research there is this identification of how many percentage is really stunted, how much is overweight. But along with that, I think if you have the information on does it happen in the rural area or the urban area, and then what are those activities that prompted these subjects of your studies to have that much of, let's say, lifestyle that leads to having high, So if you have those, so maybe that would help, because these things, even if DOH would continue, even if I don't know if they really do give out the compacts, as Doctor has been saying, no? I hope they are. But even if they continue doing this, I think it is a much cheaper and better approach to the problem if we do the community education on the prevention of these things.
Yeah, I agree with you 100%, Doctora, that the way to address what we call these non-communicable diseases like hypertension and diabetes is through prevention, because treating them is very expensive, as we all know, and as even DOH realizes. But I think this is a situation where we do not yet have the programs fully in place, because what are the risk factors for these conditions? Number 1, as I mentioned, was diet, then physical inactivity, and then you have smoking or tobacco use, and then you have a harmful alcohol consumption. So ang harmful alcohol consumption is taking what we call binge drinking. Yung binge drinking is taking for a male, taking more than 4 what we call standard serving sizes of alcohol. So a standard serving size of alcohol depends on the amount of alcohol contained in your drink. So for example, whiskey or gin has more alcohol than beer, for example. So the amount of whiskey in one standard serving will be just one shot, diba? So mga 30 ml, whereas the amount of alcohol in a mug of beer might be just equivalent. So kung standard serving ang pinag-uusapan, you can take one mug of beer but only one shot of whiskey, not the other way around. So ang ano doon, if you are a male, the maximum in one occasion is 4 drinks like that. If you're female, the maximum is 5. If you exceed that, you are already what we call binge drinking. This is what we call harmful intake of alcohol.
Okay. Doc, pero paano yan? May mga icons daw kasi ng mga lasenggo. Buhay pa naman hanggang ngayon. How do we deal with that?
Well, there's also individual variation, of course, in the way you metabolize things. But you cannot always rely on individual variation. Kasi baka mamaya, unang-una baka nasa lahi ninyo, no? So the genetic factor needs to come in. So it might be in your genes that you are more predisposed to these non-communicable diseases. So even if you don't drink a lot, even if you drink less than you don't indulge in binge drinking, it is still possible that you may experience the harmful effects of alcohol. The other thing is the frequency that you do it, no? Kasi some people, maybe they binge drink during rare events, like their birthday.
Christmas.
Or Christmas.
New Year.
Oh, yeah.
Fiesta, All Saints Day.
Teka, madami-dami na yan. I was going to say, maybe birthday and Christmas. O sige, let's throw in New Year. O 3 occasions a year. If you do it...
Fiesta.
Fiesta. Medyo 4 na yun, ano? Pero the less frequent, the better. Kasi your liver has to metabolize that alcohol, eh. And if your liver is already, the more often you do it, it's like overworking something, a machine or something, no? So the more often you overwork a machine, the more likely it will break down, right? And unfortunately, we don't have spare parts for a liver. And the treatment for liver disease is not easy either. Okay, so I think that the less stress you put on your liver, the better. So that's why I was saying maybe your birthday and then Christmas. Tama na yun. Pag lumampas ka pa doon, pinahihirapan mo na yung liver mo. Yeah. At kung ginagawa mo yan tuwing payday, ay lalo na. Because there are people who do that. No? And our survey shows, and this is a cause for concern, there is increasing prevalence of binge drinking among the young, especially. So it is the 20 to 29-year-olds that have the highest episodes of binge drinking. And we used to see this only among males. We are now starting to see it also among females. They're not yet quite as high in prevalence as the males, pero humahabol na. So
is it because of the job they have, like call centers?
It's possible. It's also, I think, because of changing norms. It's not so much because of the jobs as because of changing norms. So medyo mas may, how do you put it? There's less social pressure on females to conform to certain behaviors. Noong araw kasi, mga katulad namin, hindi kami makalabas ng bahay ng basta-basta.
Strict po ang parents natin.
Ngayon, yung mga babae, hindi mo na alam, yung mga anak mong babae, hindi mo alam kung nasaan until umuwi. Diba? So, and even if you have cell phones and you're tracking them by cell phone, they can always tell you they're somewhere safe, but they're not. So, I think these are part of the changing norms. So,
so kasalanan ng simbahan
isa yan. Hindi ko naman sinasabing simbahan. Kasi ang norms ay hindi lang naman
sa simbahan.
Trabaho ng simbahan. Yan ay ng society. And I think that the church is just one of the forces in society. And in fact, I wish the church would exert a stronger force in society, because there are certain things that the church stands for, like stability and morality. So yung mga ganyan kasi keeps certain things in check. So one of them is excessive behaviors, risky behaviors. And it's not just in drinking or in food consumption. There are also other things like sexual behaviors. But we can discuss that a little later. O, sige.
May reaction.
Gusto ko lang mag-comment. Kasi ito na nga yung sinasabi natin na things that lead us to where we are now, yung mga nabanggit ni Doktora. So, siguro talaga, we have to find activities for the family na talagang yung key behavioral change. Yun ang kailangan natin. We have to direct our youth dun sa, or even the adults for that matter, no? We have to develop that behavioral change. If we really want to change if we do not want to go to that situation na lahat na lang tayo by the age 30 nasa ospital kasi may sakit, no? So, siguro what we can do is always go back to basic, no? Ano ba yung mga fundamental structures? Family, church, and school. So we teach in the family. We sit down with the kids, no? Kaya lang parang ang hirap, lalo na kung working mom. You cannot even have dinner with the kids kasi pagdating mo tulog na. Which is what is happening now. That we have to work. We have to have more time working. And then for the church, kasi during my younger years, yung lolo ko, we'd always call us to have a rosary every 6 in the afternoon. And I don't know if there's a family that is doing that right now. So, you do. Very good, Doktora. With all the family members, the titas and the tito, no? And then the other one is the school. No, if we could just, siguro yung DOH is working on having a healthy Filipino, or good environment for all Filipino to be healthy, but I guess it would help for the behavioral change that we want if the idea of being healthy is introduced at the youngest age sa school pa lang, sa elementary, preschool. So maybe it is not only the Department of Health who should be in the highlight of this, but also the DepEd, the CHED, and all the teachers, all the church members. I mean, even the parents should sit down and work this out and have a clear thinking of what we really want in the future.
Mm-hmm. Actually, nagsimula tayo sa health eh. Bumalik tayo dun sa mga issue na hindi natin nakalaing may impact sa atin. Father, binanggit yung simbahan. What do you think should the church do?
Well, let me first mentioning so many statistics here, just a fact without giving exact figures. I'm dealing with people who sleep on the streets, and a major cause for people sleeping on the street is family problems. Sorry, thank you. Is family problems, which an organization I'm helping, I don't want to give names, just got from a government organization 10 elderly people. Why were they there? All 10 because of family problems. The main cause of poverty for the US and the UK is lack of education. We all know that. If you don't finish grade school, your chance of having a decent income is low. But the second reason is single families. That includes broken families and so on. I mean, not an economical reason, and yet it is the second major factor for poverty in the UK and the US. But I also have something positive I would like to mention. A while ago, when you were talking about the fast food and so on, it came to my mind, I won't give the name, a chain that we have here in the country of fast food, and there are 700 branches. You might guess which one it is, never mind. But I also thought that another chain that sells low-cost medicine, because you spoke about government intervention, and they have at least 1,600 branches. I want to say, despite the fact that we have too much fast food. We also have people who are promoting low-cost medicine. And one item I think about now is that in a regular drugstore, the big ones, it costs 10 times as much, the same tablet, same ingredient, medical ingredient, as in that particular chain. So I want to say we have quite some progress too at the same time. We have low-cost medicine in our country. I think we should try to get to low-cost consultations without decreasing the income of the doctors, because they have to survive also and take care of their children. But I mean the system. We must come up with cheaper systems. Just like we have a cheaper system for medicine. We're not telling that those who sell the medicine can have an income. It's the system that we should try to change. You also spoke there about government intervention for medicine, but it should also be for hospitals. Why should only the government hospitals be subsidized? Why not the private ones? You get subsidized not because of your faith or your private initiative, but for the services that you're giving. Besides, government money is taxpayers' money, so I don't see any reason why that should be different. You come up with a certain formula, so much per patient per day. I don't know about how they calculate the subsidies for the government hospitals, the same kind of system. That would be more fair, and then people will save more, and I'm sure we'll have much more effective medical care. Like, again, I don't want to mention another country. I mean, I'm not talking in the air, saying that there should be subsidies regardless if you are private or if you are government. Then, of course, you must adjust the rate that you charge accordingly.
I think.
Yes, please.
Yeah, I think Father just brought the court to universal health care. This is, well, it's not so much in terms of a subsidy, Father, but in terms of PhilHealth coverage. And I think that's where I think this particular administration has gone farther than previous administrations. For example, I think the efforts to increase coverage have really been seen with this particular administration, and also this earnestness to broaden the programs that are covered. Because in the past, it has only been confinement and only up for certain conditions. But now, they now have what they call this Z package, where they provide coverage for cancers, for dialysis, for cataract surgery, but not yet for hearing loss, Father. I think we should work on that. But you know, there is increasing, and I think also for disability. So there is increasing coverage of PhilHealth for these conditions. There is also now move towards covering even outpatient benefits. That's going slower than we wanted in the universal healthcare study. But it's moving. It's moving, but very slowly. And we're worried that we won't have it in place in time for the change in administration. That's a worry because what we were expecting, or what we had hoped for, was that we would have enough of these changes in place so that people can actually feel them already, and that they will come to expect that these are the kinds of services that good government should be providing, so that when the next election comes, they will be choosing leaders who will provide these kinds of benefits to the people. So, yun sana yung hope that we will get these benefits in place under universal health care in time, so that people can feel them and then expect this of government. Because the reason why we keep I think, in my opinion anyway, why we keep electing officials who do not deliver is we do not expect them to deliver. I think we have to expect it so that we choose the ones who can do so.
Yeah. Thank you for the addition. Yes, Doktora, bago natin
Question lang, I just saw in my FB account the 100% coverage of all senior citizens, and yung kanilang mga dependents, like a child who is less than 18-year-old or not yet married. So ibig sabihin, libre na covered na si senior, pati si dependent niya covered pa rin.
Hindi ako sure sa dependent niya. Alam ko si senior, definitely covered na yan, 100%.
Hindi ho ba pang election lang yan?
I don't think so. Well, kasi matagal na yung plano eh. Matagal na yan in the works. The other thing was, we were also, meron na rin yung automatic enrollment when you are going to deliver, when you're pregnant or going to deliver. Oo, so, yan yung problema between the policy formulation and the implementation. As Father was saying, it's easier for government, of course, to mandate government facilities. That's why it moves faster with government facilities. With the private sector, there's a lot more negotiation that goes on because many of the private facilities will just say, if you're going to use your PhilHealth, we will not accept you because, well, they have their own reasons why they won't do that. And so they will drive away the patients to other facilities. I know that happens. But I think PhilHealth is working on that kasi ang nila, sige, we will not accredit you. And if we do not accredit you, then only those who can afford to pay out of pocket or who have other means of paying for their health care will be able to go to your hospital. That's fine if there are other government hospitals in the area that can absorb the patients that the private hospitals cannot absorb. But I think there are still places in our country where we do not have enough government hospitals. And so that's the reason why people go to the private hospitals because they cannot be accommodated in the government hospitals.
Pero doctor, kasi we've experienced, kasi we have 102 chapters and each chapter have a minimum of 2 ambulances per chapter. So we tend to bring the patients that we get. Usually naman, libre lang naman sa Red Cross yun eh. Yung tatawag ka, may pasyente, o kaya may nadaanan lang na pasyente, pick upin namin yan, dadali namin yan sa government hospital. So even if we tell the hospital na, ay may PhilHealth po si Manong, dito na po namin iiwan, hindi nila tatanggapin. Sasabihin pa nila sa government. Oo, sasabihin pa nila sa amin, bakit kayong Red Cross dala kayo ng dala sa amin ng pasyente? Anong gagawin namin dyan? Iiwanan nyo dyan. So nangyayari, yung volunteers namin who brought the patient to the hospital cannot leave the patient.
I think you may be in a facility that does not have the capacity to manage that kind of patient. Kasi that also, Kasi at least, in my experience, yung mga district hospitals, for example, do not always have, lalo na if they are run by the local government.
So what you're saying, the devolution was more of a devil's solution.
As far as the health system is concerned, I have to agree with that.
Not all governors and mayors are doctors of medicine. Most of them are politicians.
Yeah, I have to agree with that. Kasi and we have data to show that under devolution, some of our programs really, the performance of some of our programs really declined. And so it is something that central government needs to address. But there are also programs where even after devolution, they continued to do well. But these are the ones where there has been really heavy support from central government. So for example, our immunization program, our vitamin A supplementation program, yung mga yan, heavy government support. All the supplies came from national, all the training.
These things, the immunization program is supported by WHO. That's why...
No, that's not true. DOH is paying for the vaccines. It may be that in the beginning, in the 60s and in the 70s, that the WHO may have been providing support.
Okay.
But since, I think, the 1990s, the Philippine government has been paying for the vaccines that we administer to our children. So that is a misconception. The support, it's not support, it's assistance. UNICEF helps DOH procure the vaccines in the sense that UNICEF acts as the, anong tawag mo dun? Parang global, they hold bids at a global level.
And that's
So
the
the
reason why Dr. Ona is no longer there.
That's a separate story. But the procurement is at a global level. So, mas mura nating nabibili yung vaccines. Oo. But that's not support. That's more of assistance. Yes. So it provides the conduit so that we can buy the vaccines more cheaply.
Pati po measles.
Pati yung mga gamit. Oo.
Okay.
Although ang give and take doon, LGU na dapat yung nagpo-provide ng mga needles and syringes and manpower, DOH yung tao.
Yeah.
Ay, yung tao, yung vaccine, sorry.
Kung di ako nagkakamali, kaya meron mga galing pook awards ng DILG. Ito yung mga matatagumpay na LGUs. Kaya lang, ayaw namang ilabas ng DILG yung significant failures. So we can study closely ano nangyari. Yes, please. Please identify yourself and the entity you come from.
Archie Almeida from Liga ng mga Broadcaster ng Pilipinas. Broadcaster po ako, columnist. Anyway, katext ko po si Congressman Benny Bardoni at saka yung ibang local government units doon sa Eastern Samar. Ang sabi po nila, sabi ni Congressman Bardoni, we have provided budget for that as a congressman, sabi niya. But the trouble is, nasa local government, nasa LGUs ang implementation, particularly of the governor, sa Office of the Governor. There was one case in Homonhon na inatake sa high blood yung tao. It was only after 2 days nang ma-transfer sa Giwan. Pagdating sa Giwan, wala na because there is no sea ambulance. So, ito yung failure kung bakit yung health services natin, not only because lack of doctors, but the facilities and equipments para ma-deliver ng gusto yung services. What is lacking? Although there are some provisions or some legislation to effect na magandang health services tulad ng pag-i-establish ng community hospitals na sinasabi niyo, parang bodega. It was only after the Yolanda, through the NGOs daw, ang sabi po sa akin ng isang bokal, si Daipen, na-establish itong parang kung hindi pa sa medical missions ng Red Cross, volunteers at saka NGOs. So, the bottom line, ang failure ng deliveries is nasa LGUs because of the devolution. Now, my question is this, kasi ganito po yung nangyayari talaga sa family. And I am from Samar. Lumaki po ako sa Ginamos at saka Kinudkud na inyong. And there are, the basic staple po is yung kamote, kurot, balanghoy, mais, and saging. Yung saging, just imagine, hilaw pa, sinasawsaw mo sa Ginamos.
Okay.
So, economic struggle, bago ho yung health concern. Before the health, matignan ng pamilya, yun muna dyan. So, ito ho yung basic na problema.
Okay.
How can the universal healthcare program resolve or approach to resolve this problem?
Medyo mabigat yan, ha? Alam mo, dapat kay Presidente mo tinatanong yun.
Hindi na yan universal healthcare. Universal access yan to to services. To services and opportunities. So I think malaking yan, it goes beyond health. And I agree that health might be, already in the middle of that kind of equation. Pero this is how I see it naman, while it's true na dapat economic development. When you're talking about helping the poor, ang investment natin sa poor comes in mainly two forms their health and in their education. Now, kasi kung wala silang health, di sila makapagtrabaho. Kung wala silang education, limited yung opportunities nila. Now, how do we get the health to happen? I agree with you that food is a main factor. And here's where the relationship between national and local governments really has to come into play. Because it is the local government that knows the situation of the people in their area. But it is national that has the policy and the financial support that can move programs and policies. Yes. So they need to work together. And gaya nung nakita natin sa Yolanda last year, nag-aaway pa imbis na magtulungan. And naiipit yung tao sa gitna.
And to think they serve the same constituency. What is there to quarrel about? Now, Doctor, you mentioned about fast foods and the like. President Evo Morales of Bolivia closed the last McDonald's in his country 2 months ago. And he was hated by the multinationals because it's business, according to them. But the president said, we have to close this because it doesn't contribute to the health and well-being of my people. So I have the job to do it. Do you think we can strike a balance, especially with Jollibee as one of the top money-making companies in the Philippines?
I think you have to provide people with options. I believe in that. Di naman sa dapat mong patayin yung industriya, yung food industry, but the food industry needs to come up with healthy options. So, dapat hindi lang yung mga heavy in fat and sugar, pero meron din yung mga yung sinasabi ni Sir kanina na kamote and mais. Oo, kasi tingnan nyo, he looks fit and healthy at his age, and I think a large part of that may have been the healthy diet that he had as a younger person, di ba? No, so I think if we have these options available, then pwede, oo. Kasi fast food din naman yan In fact, pag nagmi-meeting kami, sinasabi ko dun sa mga kasama ko, bakit kayo magpapabili ng fast food? Dyan lang merong boiled corn, merong boiled peanuts, na pwede mo namang, merong boiled bananas, which are healthier options during meetings. And even a place like Aristocrat can offer these things.
In 5-star hotels in China, they offer sweet potato for breakfast. Yes. Part of the buffet. Yes. Pero ang problema kasi, iba yung dating Iba yung dating sa Pilipinas. Do we have more questions on the floor, please?
Dr. Tess Ramiro, Catholic Media Network. Thank you, Dr. Ses, for providing the perspective for nutrition. Pero ang question ko, we have identified even before the 10 provinces that are under the poverty-stricken provinces. How do you correlate nutrition with the 10 provinces that are linked to poverty? And what's the status now of these provinces in relation to nutrition? For example, Masbate, isa yan sa pinakamahihirap na probinsya. How do you correlate nutrition in Masbate? And what's the status now? Of course, there are other provinces, no? Aside from that, corollary to my first question is this question on how is urbanization affecting nutrition?
Yes, please.
Let me start with poverty. I'm right now doing an analysis of how different health programs have performed from 1990 to 2015 as part of our MDG report. And one of the things that we noticed was programs that are heavily supported by central government. Kasi what we did was to, let me backtrack a little. What we did was to group the provinces by poverty levels. And then we tracked the performance of these different groups of provinces over time. And we tested whether any change over time was due to time or was due to being grouped in that particular wealth quintile of the province, of the provinces. And what we found, kasi we could only do this with certain programs that have data over time. Hindi lahat ng programa kasi natin may magandang data eh. But of those that have available data, and this is why I brought up the issue of immunization and vitamin A supplementation, these were the only two programs where poverty did not matter. The others were prenatal care, birth attendant, professional attendance at birth, and facility births. Those three other programs, poverty did matter in the sense that the poorer provinces had also poorer performance. And I think that that's because of the investment needed in order to have a professional attend the birth. Kasi kailangan mag-invest ka doon sa training ng taong yon, sa sweldo ng taong yon, and then to ensure that that person stays in the place where he's supposed to serve. Same thing with facility delivery. You have to invest in the facility, make sure it's equipped, make sure there's running water, there's electricity all the time, and then so on and so forth. So pagdating dyan, doon tayo nagkulang. Also, kasi merong health facilities enhancement program ang Department of Health, pero medyo late pumasok eh. We saw the changes only mga bandang between 2008 and 2011, and then the larger changes between 2011 and 2013. So I think these investments of the government in DOH are actually starting to show its effects. Pero medyo, bandang recent na. No? So, it's nice to attribute it to the current administration. Kasi there's no other explanation.
So, kasalanan niya nung dating administrasyon?
Alam nyo ba na yung dating administrasyon, sino ba yung nagsabi sa akin? One of the former secretaries of health, I don't remember which one, sabi niya sa akin, palaging kulang ang budget namin sa Department of Health. From about 10 to 20% ang kakulangan ng budget, yung operational budget ng DOH. And he wasn't even talking about a very extravagant budget, but just to deliver the basic services. But under this government, I don't know if you're aware that the DOH budget has been geometrically increasing. Sabi sa akin, this year, 2015, the DOH had programmed parang 80 billion pesos for its operations, and they were given more than that.
Savings ata po ni Dr. Ona.
Pwedeng savings ni Dr. Ona. Pero at any rate, ang ano ko lang is, they were given much more than what they had asked for. And that's a signal that the government is really serious about putting its resources in social programs. So I hope they're also doing the same for education, kasi si Brother Armin, mas konti na yung mga naririnig natin sa news na kulang ng eskwelahan, kulang ng classrooms, ganyan, teachers, di ba? Mas konti na yan sa news except nung nagkaroon ng mga disasters na nasira yung mga eskwelahan. But we give allowances for those kinds of situations. But I can see it in our data that things are happening which have not happened before.
Yeah.
I wish they had happened earlier so we could achieve our Millennium Development Goals.
Yeah, there was a time when Tita Cory took over in 1986, and the health minister at the time was Alran Bengson. And he went to Bicol, and the regional director showed his statistics, and the then Secretary Bengson said, cut it in half, I'd like to believe the other half, rather than what you have. So could this also be possible, that statistics being reported today may not be as believable?
Well, let me talk about the National Nutrition Survey, because that survey comes from a nationwide randomly selected survey. So I would like to think that it is scientifically sound. The statistics that you're talking about are the ones that are routinely reported. So these ones come from the facilities and the providers themselves. And for some of them who are given a motivation to change the statistics, that is likely to happen. But there are ways of checking that now, which didn't exist before, because technology is now getting better. And so if somebody decides to pad the statistics of his place now, it can be picked up earlier than before. Dati, it will take 5 years bago mo mapansin na may problema yung statistics. Ngayon, within a year or two, we will notice that there's something wrong with the statistics being submitted.
Thank you. Father, would you care to react before we
Yes, I
open
would
the floor?
like to react to two aspects, not to everything. I cannot really judge the case of McDonald's in Bolivia. I don't know the particularities. But in general, I would like to mention this. Why should we treat McDonald's as a very bad company beyond repair, unchangeable, permanently bad? Why would we think that the president has all the wisdom by the fact that he has been elected, and that the citizens are just low IQ people who do not know what they need? I think that's old style. I would think that the president got good ideas because he studied the issue or somebody informed him and so on. We must do the same for the people. Give the people information like Mom is doing, study the issue and so on. Treat the people a bit as intelligent, maybe a bit less, but still a little bit of intelligence, just like you are. And private companies, they just sell what people want. If people don't want to buy any McDonald's, they will close on their own. They will not stay open if they cannot sell a single hamburger or whatever it is. I think we should apply his own way of learning to the people and then see the effect. If we can convince the people, the rest will follow. The man spoke about universal health care for the elderly you mentioned. Elderly is free, I guess, before I'm elderly. If you have paid already for, I think, 120 months. Not anymore. Well, I'm from the old style. I'm a little bit older than that. Yeah. Okay. Then, but for my main concern is the people who sleep on the streets. How can they get health care? Before it was 100, now it's 200. It's still a bargain, because on the average you get much more than what you pay. It's subsidized. But how can you get people on the street, no permanent address to do this? I wrote through 3 major banks, no reaction. I wrote the second time, again, no reaction, nothing. To come up with a plan on how it can be realistically done. Because you cannot expect people from the street to walk into the bank and deposit 10 pesos for their account to pay for the healthcare. That doesn't work. So we must come up with a more realistic system. And that are things we should hopefully work on.
Yes.
Yeah, I think
Please
Doctor, still a
identify
hanging
yourself.
question, ano? May question pa raw siya na hindi pa nasagot. Doctor.
Which one was this, ma'am?
In your analysis of nutrition problems,
Yes.
we have identified several provinces.
Yes.
Then how do you describe the nutrition
Oo.
problem with urbanization?
Okay. So, we haven't done the analysis for the nutrition. So, we've done the analysis for immunization, although vitamin A is, nutrition also, and facility births. But we're getting to the nutrition because we just got the nutrition data. So, I hope you will invite me again and then we can talk more about nutrition. Now, in terms of urbanization, what we notice is that the urban areas have higher rates of these non-communicable diseases. So we are seeing more hypertension, more diabetes in the urban areas compared to the rural areas. And we are seeing more of the undernutrition in the rural areas. So yung sinasabi ni Sir, yung example niya about Samar, I know that that's true. And I can say the same thing for many areas in Mindanao, some areas in Luzon, but mostly in the Visayas and Mindanao, yung situation of undernutrition.
Okay. I remember asking the Surgeon General of the Philippine National Police, ano yung kinamamatay ng police sa Maynila? Sabi niya yung hypertension-related illnesses. Kako, how true is it na ulcer yung kinakamatay sa probinsya? Lifestyle. Nangiti na lang yung Surgeon General. Please identify yourself.
Yes, I'm Neil Narca. I'm a former journalist. I covered the Philippine National Police and Camp Aguinaldo. Dapat nandun ako sa kabila ngayon kasi si Senator Lacson daw yung guest speaker doon. Sabi ko, mas importante sa akin yung health actually, no? Because marami tayong problema sa bansa pagdating sa kalusugan. And in fact, if you know, meron tayong team song sa devolution ng Department of Health. Yung they just lie there and die there, no? Pagka lalo na yung mahihirap, especially yung kwento nga ni Doktora kanina sa Philippine Red Cross, ang sabi niya kanina, tinatanong siya, bakit nyo dinadala rito yung mga pasyente, di ba? Siguro, ang katotohanan ngayon kasi, mga public hospitals, there are no medicines or there are not enough medicines to cover all those patients, lalo na yung mga mahihirap. And so, sayang, wala rito yung Department of Health kasi yung pinaka-main question ko actually is yung frontline community health, no? In relation with promoting our sources of natural medicines. Where have our halaman gamot gone? Nasa na yun, di ba? Kasi pre-promote nila Secretary Flavier and Secretary Romualdez, no? Way back, yes, Republic Act 84-23. So,
namatay na sila pareho.
Yes.
Namayapa na.
Namayapa na, no? Yun nga, so, sayang kasi marami tayong source of natural medicines na kung sinasabi ni Doktora kanina, ang budget po sa Department of Health ay hindi sapat para sa mga ganitong mga pangangailangan, lalo na sa rising poverty, no? Sa rural areas in comparison with the urban localities, no? So, don't you think as medical doctors, don't you think that we should go back to basics? As what you've said earlier, Doktora, hindi lang yung, for example, yung sa 6 o'clock habit, no? Eating the right foods, no? Coming up, yes, regulating medicines which are which comes from local sources, no? So, what's your take on integrative medicine, doctors, please.
I'm glad you brought that up. That's actually an area that I'm very hopeful about as far as DOH is concerned, because they have appointed just recently si Dr. Cecilia from UP Medicine, College of Medicine. Kasi si Sid is a researcher and practitioner of traditional medicine himself. Kasi in the past, some of the people who have headed PITAC is the Philippine Institute for Traditional and Alternative Healthcare. And hindi ko naman ninamasama yung mga naging dating heads ng PITAC, pero meron silang mga naging heads na hindi naman talaga sila practitioner or researcher ng alternative healthcare. And so I think they did not have the same passion and commitment that Sid has. And so I am hopeful. He was appointed late last year, maybe November of 2014. So I'm hopeful that there will be many changes in that direction, because we do have many alternative treatments that are very good as adjunct. I'm calling it as adjunct,
yes.
No? Ibig sabihin, kasabay.
Kasabay, yes.
Oo, kasi
Complementary, parang
kung
ganun.
prevention, pwede pa siguro na siya lang mismo, like if you eat our vegetables that have medicinal properties, salads, ganyan, then vegetables by themselves, of course, are healthier foods, no? Pero hindi, kung ikaw ay may malalang sakit na, hindi mo pwedeng asahan lang ang halamang gamot.
Yes.
I think we have to be careful about that because hindi kakayanin. Pero ang halamang gamot, pwede talaga yan for prevention. And as a partner to other remedies. So for example, alam ko yung ampalaya leaves, halimbawa, na pinopromote din ng Department of Health for diabetes, is a very good adjunct treatment for high blood sugar. So pwede mong inumin yan or kainin, sama sa pagkain. So these are, yes sir.
Ano po yun? Ginagamit?
Ampalaya leaves. Dahon ng ampalaya. Oo.
Diabetes.
Oo. So pwedeng gamitin pag mataas ang blood sugar in partner with the medicine. So what the research has shown is that it helps bring down the blood sugar.
Okay.
Oo. So may mga iba-ibang commercial products na available, pero pwedeng yung mismong halaman din naman eh. The young leaves can be used as salad or in soups.
Dadagdagan ko po, gagatungan ko pa. Bakit merong mga food supplements na ina-advertise pagkatapos ang kicker, no therapeutic claims?
Yeah, that's it.
So how di Carabao?
Yeah,
Although
tsaka
approved ng FDA.
papasok po yung mga gamot from ASEAN neighboring countries, ASEAN Integration 2015, wala namang nakalagay sa kanilang no therapeutic claim. Tapos tayo meron.
Dapat meron kasi para pare-pareho eh. Actually, ang alam ko dyan, they are now standardizing, supposedly, standardizing the way these products should be labeled. Kasi para pantay-pantay nga ang trato. Kasi sa ibang bansa, sa ASEAN, pwedeng hindi kailangan ng ganong label. Pero kung gusto nilang mag-market dito sa ating bansa, kailangan sumunod din sila sa bansa natin. Pero pinag-uusapan yan sa ASEAN eh.
Yeah, pero doktora, remember, tayo lang ang bansa sa ASEAN na merong no therapeutic claim. Sa kanila, they regulate herbal medicines, not overdoing it, no? As long as it has proven safe, no? It has quality, pwedeng ilabas na yun sa merkado. Ang take ko dyan is that regulators must not be a burden to local manufacturing companies, especially SMEs, no? Na nag-i-invest din. And yet, pag pumunta sila sa FDA, ang higpit ng regulation. See, so sila, nagpo-fold up sila. And even foreign companies who have this kind of medicines, they tend to fold up and relocate to somewhere else, like Singapore and Malaysia, because they have much, not lenient, but their rules are quite simpler and easier to comply with.
Maraming reforms kailangan sa Food and Drug Administration. I have to agree with that. I'm really sorry that Dr. Kenneth Hartigan-Go, who is also with the Universal Healthcare Study Group, decided to quit last October, and so he's now back in the private sector. He was there for only about
2 years.
I think 1.5 to 2 years.
2 years.
So sayang,
Yes.
but kasi during that time I was again hopeful na many of the, and in fact natutukan niya yung ibang mga bagay eh. So for example, yung implementation ng ating asin law, yung iodination in salt. Natutukan niya yun eh. So merong mga pagbabago kaming napansin doon. So some things move when you have the right person talaga in
Oh,
charge.
yes, but he's complaining about the budget sa Department of Budget.
Oh,
Doon siya nagkaroon ng problema actually.
But that's another topic
problem
siguro.
yun.
Of course.
Oo.
That's another topic. We can talk about it later.
Yeah, thank you so
All right.
much.
Thank you. Yes, please.
Good morning, Judge. I'm Bayani Nito. I'm a concerned citizen. I'd like to address this question to Father Luke. Father, it is written in the Bible. Herbs.
Teka muna, baka lumayo tayo dyan.
No, I heard.
Bible
No,
yan,
I heard about herbal medicine as adjunct treatment. So I'd like to clarify this matter. Maybe our directions as human directions in our country is misleading. That's why I'd like to ask a question like this. Father Luke, herbs are for healing and fruits are for eating. Herbs are for healing.
Herbs are pro-healing.
And fruits are for eating. It's very clear. It's written in the Bible.
Herbs are
So
Fruits are for eating. Herbs are for healing.
for healing.
Yes, okay.
it's in Genesis.
Okay,
Herbs
okay.
are for healing and fruits are for eating. It's really very clear. It's written in the Bible.
Now, what is the question?
The question is, our contemporary times, when you talk about doctors, experts, they will tell you that herbs are adjunct treatment. I think it's the other way around. Herbs are the real treatment, and those medicines, chemical medicines, should be an adjunct treatment.
Okay.
First, the Bible is not a medical book. So we do not worry. Thank you, Mom. Thanks for reminding me. And sorry for asking the question twice. I got the hearing loss, medium, moderate and mild, so I'm excused. And having a hearing hit will not help much. And Mom said that it's not yet covered by healthcare anyway. Joke lang. I want to say, we do not read the Bible to find a medical solution. That is a science. The Bible is to express how I see my relationship with God. So you can quote me many things from the Bible, I will say, not appropriate. What we can say is that, yes, we have to eat and so on. But the person who wrote this did not want to say, that is for healing and healing only, and that is for eating and eating only. No, because we eat to be healed also. There's a relationship. So I will talk about this, about that. That there is in our world things for our health and so on, yes. That we use the normal processes, yes. But not to impose, to oppose the Bible to our medical science.
Can I ask another question? Maybe the doctor also can answer this, Doc. I know for a fact that when you talk about conventional medicine, the raw materials are chemicals, right? And chemicals per se, if you will dig further about the science that the Father Luke is saying, this cannot be, cannot processed by your body. They cannot assimilate with your body.
I will first let Mom answer, but I want to say your distinction between One are chemicals and the others
It's
are
natural.
natural.
Herbal medicine is natural.
Chemicals are also natural. And if you talk about the vitamins which are supposed to be natural, they include chemicals. If you like it or not, in my natural blood, there are chemicals. So we should not make that categorical distinction between the two.
Yes, there is natural chemicals, Father, and there is this synthetic chemicals, yes. That is the distinction.
Synthetic, whatever I
Yes,
don't know
yes.
say. But I would not put all the
And
synthetic,
synthetic
on the same
chemicals
level.
cannot be processed by the body.
Okay, tanongin natin ng
Yeah,
doktor.
yeah.
Yes, doc. Maganda to eh. Lumalim yung usapan.
Actually, when you go down to the basic molecules,
Yes.
what you're calling as synthetic also get assimilated by the body. Otherwise, they will not have the effect that they are intended to have. So, because all of these medicines that are, how do you put it, that have passed through the drug trials have all been tested. And so, I think that it really depends on what the expected effects are. So they were tested for the expected effects. But there is no perfect treatment or medicine in the same way that there is no perfect person except God. Diba, Father? O, sige. So, there are treatments that will have what we call adverse effects or side effects, whether it's natural or synthetic. You will have that. It depends on the interaction between the substance and the person and the environment in which that substance is consumed. So whether the substance is naturally sourced or synthetically sourced, if it has passed through the trials of our regulatory agencies, I think we can at least be assured of one, yung safety ng product, and two, the efficacy of the product. Now, we cannot say the same thing for all natural remedies because the natural remedies have been brought down to us through experience and not through trials. And therefore, it is very possible that the experience of one healer has been very positive, but maybe you talk to another healer and that may not be true with that healer. That's not the case for the substances that have passed through the trials. Kasi yun talaga, tinest in a scientifically acceptable manner. Now, that's the reason why no therapeutic claims ang nakalagay sa mga natural products because they did not pass through those trials. But if they did, then wala yung phrase na yon.
Okay.
Just one comment. Thank you very much for the explanation, but I have to remind you, there is a study in the US that the number of deaths is attributed for toxicity in the synthetic medicine. You can check it. Thank you very much.
All right, thank you. Okay, one thing is certain. Mahalaga ang buhay ng tao. Pero nalalabi pa rin yung issue ng kahalagahan ng breastfeeding. Tanong, Doc, kayo po ay nasa FNRI. Effective ba talaga ang breastfeeding?
O naman, that is the best food for babies. And that has been scientifically proven, and that has also been proven by the test of time. Because if we did not have breast milk to begin with, none of us would be here.
Okay, kaya ko na itanong, one would be wondering whether some of our government leaders were breastfed during their infancy. Nobody has said, uy, pinasuso ko tong anak kong to. Dahil ito ang nangyayari sa atin ngayon. Isa pa rin realization ko sa ating pagpupulong, sa ating talakayan ngayon, walang ospital sa tanga. Pero may pag-asa ang bobo. Yun. Mahalagang bagay din yun. So, di ba? yung medyo may kalungkutan at may kakulangan sa kaisipan, may pag-asa pa rin. Dahilan sa ang lipunan ay dumadalo sa kanila. Isa lamang ang pangamba ko dahilan sa binanggit ninyong trials. I remember there was this experience in Albay when John Hopkins or one hospital, university in the America tried testing vitamin A, which resulted to bulging fontanelles. And this was a question for people in Albay. Ano ba yung ibinigay ninyo? Yung bang anti-tetanus, may pampalaglag. Ayan, that's another issue. Pero huwag na natin pag-usapan ngayon sa susunod na yon. I would like to thank our guests who took time out to be with us. Si Dr. Reyta ng Red Cross, si Father Luke, at si Dr. Celis, who took time out to be with us. No? Si Dr. Acuin, si Dr. Ces Acuin. Siguro, bago tayo magtapos, bigyan natin ng pagkakataon si Father Luke to lead us in prayer for the World Day of the Sick. No? Let's all pray with Father Luke well, please convey to us your blessings as well.
Let us then remember that we are the holy presence of God, Him, the Father and the Son, Holy Spirit. Amen. Lord, we thank you for Pope John Paul II, who some 22 years ago started the movement for World Day of the Sick. We thank you for your Mother Mary, on whose feast day we are celebrating the World Day of the Sick, Our Lady of Lourdes. We thank you for the popes who every year have sent us their message on how we can bring the love of Jesus to the people who are sick, who suffer in all parts of their bodies, and promoting a holistic approach to sickness and health. We thank you most of all for your example of caring for all the people, despite misinterpretation, misconceptions, severe laws that were against it, customs that were against it, to bring your love to the people who suffer. Help us now to bring the same love of Jesus in today's society with the means that we are having today, so that we can alleviate suffering and bring them all your love and joy. This we ask through Jesus Christ our Lord. In the name of the Father and the Son, Holy Spirit. Amen.
Thank you very much. Next week, please come early because the topic will be traffic. Maraming salamat po.